Abbie, and I am a research assistant to Dr. Catherine Swoboda at our lab at MGH. I'm very excited to talk to you guys today about my thesis study for my master's program, which is a focus on Flunarizine and how we can ignite this path to FDA approval in the United States. Next slide. So this is just a brief outline of everything we'll be covering today, just a little bit of background on Flunarizine, talking about my study specifically, and then what we could view the next steps are in this process. Next slide. I did want to get a brief introduction on myself as well, just because I am such a new face to the community. I graduated from my undergrad from Iowa State University. I'm not sure if anyone is a Midwesterner from here that's on the call, but I graduated with my Bachelor of Science in Biology, and then last year I started my master's program at the MGH Institute of Health Professions here in Boston, where I'm working my master's in genetic counseling. Through that opportunity, I was connected with Dr. Swoboda and her genetic counselor, Helen Chen, where I'm joining their team as the clinical research assistant, working on their natural history database that's funded by the AHC Foundation. And while doing that work, I just wanted to honestly take on more and keep working on AHC, and so I ended up dedicating my thesis project for my master's degree to furthering this research as well. Next slide. I just wanted to briefly address some of the history of Flunarizine, because I know this has been a long journey since it's first been reported as a treatment before I was even born in the 80s, and so I wanted to acknowledge that this was first reported almost 40 years ago now as a treatment, but since then there are still a lot of unanswered questions. So there has been support through a small case series that show that Flunarizine can reduce severity and frequency of episodes, but like was mentioned just previously, that how to understand the response or who responds best is still highly unknown. There's also been reports that stopping Flunarizine has dramatic effects if someone and can cause life-altering, episodes that some individuals cannot return from, and so understanding how that affects the protective effects of Flunarizine as well. Next slide.
Sorry, there is a bit of a lag on it.
And more recently, it's also been noted that long-term use of Flunarizine in other populations can cause movement disorders and Parkinsonian movement disorders. And of course, this is in other patient populations, but it raises the question if long-term use can cause movement disorders in a patient population where we're treating movement disorders, what that long-term interaction looks like. Also wanted to note that there have been no adequately powered or large enough clinical trials done to understand the short and long-term benefits and adverse effects. And like mentioned previously, the metabolism is highly varied and not well understood. So understanding this further dosing is important to optimize the treatment. So why do we need another Flunarizine study? I think there's still a lot of unanswered questions that we're ready to take another stab at as we were going forward with this study. So next slide. Which leads me into the motivation for my thesis project, is understanding the parent perceptions of using Flunarizine to treat AHC. And so we wanted to start right with the people who live the day in and day out of this condition, see the firsthand effects. I will leave it to the much more brilliant doctors that presented before me to understand the molecular side of it. But we are hoping to get a better picture through the parents and through the caregivers of what this looks like and what their personal experience has been. Next slide. So some of the goals of the study aren't necessarily to answer all of those big questions that we're looking to answer about flunarizine further down the line. This is really a study that's laying the foundation for everything going forward. And so we're currently trying to understand what is the prevalence of the use of flunarizine in the AHC population, specifically in the United States. And just from the people who continue to use it or have been on it long term, are there any certain demographic, clinical, genetic features that correlate with them more likely to use flunarizine and have a beneficial response? We also want to identify any barriers in obtaining the medication because it is not FDA approved. This was very much highlighted in this early spring when all of the supply lines getting flunarizine in from India, Canada, and other countries really halted and created like a very worrisome experience for many families when they weren't sure if they were able to have the flunarizine available to them when it had to be imported and when it was caught up in customs and everything like that. So we also want to understand what are parents, caretakers understanding. What are they perceiving as the effects and harms? Are there other benefits or side effects that we're not even noting that are being noted in the day-to-day use of it as well? And finally, really want to identify what individuals are interested in participating in future clinical trials, flunarizine or otherwise, that could help us optimize this treatment going forward with FDA approval. Next slide. Briefly, I just wanted to touch on how we're doing this. We are doing, like I said, we're just laying the foundation for all of these future work. So it's just a one-time survey that can be completed online or over the phone, just a quick 15-minute one. We are hoping to get responses from everybody in the AHC community, meaning champions and individuals with AHC that are taking flunarizine, champions that have taken flunarizine and have since stopped for side effects or other reasons, and champions that have never taken flunarizine. This is really important because we do want to get that full picture of what's the prevalence of use, what's the likelihood of individuals being interested in pursuing this further, or what are the current effects that we're still seeing in this population. And so this survey is a mix of qualitative and quantitative responses, trying to understand that further. Next slide. And so I think a big question again is why now, when this has been a struggle for so many years. I think the overarching goals are really to re-energize this pathway to clinical trials and FDA approval. Our hope is that this data we're able to go directly to the FDA or partner with a pharmaceutical company in order to show that there is a need and there is a population that's using flunarizine in the U.S. And who and how many are doing that. And so we can show that there is a use for it and a need, but also kind of on the less exciting parts of working with pharma would be that there would be a market for them to make money off of flunarizine as well if they were to bring this into the United States. Next slide. So like I kind of alluded to there are definitely pros and cons of going down this path. And so working with a pharmaceutical company, that would give us the best chance of getting our funding and getting the infrastructure to go down the path to get FDA approval. So this is funding future studies, other studies that need to be funded before it'll even be accepted. But like I said, one of the main cons of bringing it in the U.S. to have it FDA approved is that there would be most likely a large increase of cost. We hope that this won't be a barrier, but we know that with insurance coverage, we would never be able to say so for certain. But it's definitely something that is to be taken into consideration as we're going down this path. But even to get FDA approval with or without working with a pharmaceutical company, we have to show that there is a market in the U.S. and there is a purpose for doing this, which is why it's so important to gather all of those opinions from our family members. Next slide, please. And so what are the benefits and what are further long-term goals of going down this path and going with this initial data gathered from this study? And so I think one of the main ones, like I said, the weaknesses in their supply lines. And so if Flunarizine is FDA approved. We're able to manufacture it in the U.S. and means champions are less vulnerable to having their treatment disrupted and having one of those adverse events if the Flunarizine is stopped. We also have the position to get clinical studies going to understand the proper dosing and to understand what those levels are and how Flunarizine is being metabolized. And so we can do clinical studies as well as pharmacogenetic studies in the future. And even working with a pharmaceutical company, we have the option to really, based on all that we're finding, is to turn Flunarizine into an even better drug, better treatment, based on everything that we're finding through these studies down the line. Next slide. So I think next steps for us in doing this study is that we hope to have all of our responses gathered and start analyzing by December of 2020, so just this year. During that time, we hope to continue talks with pharmaceutical companies for a potential partnership and weigh those pros and cons a little bit more. Depending on the decision to partner with a pharmaceutical company or not, we'll either, like I said, partner with that company or pursue the FDA investigator-initiated new drug application, and so those applications are due in January. So we hope to have that raw data and get some of that aggregate information to them by January to move this along within the next calendar year. Next slide. I do want to quickly acknowledge just the lab I am in with Dr. Swoboda and Helen Chen, who are my main supports here, and the rest of our lab. I also wanted to acknowledge some other members of my master's program faculty that have been instrumental in getting this forward. Next slide. And so if you have any questions, Dr. Swoboda, I know, has hopped on here and ready to answer anything with us. And if you're interested in taking the survey as well, we have information there as well. Thank you.
Great, thank you, Abbie. I'll just keep up the screen share for a few minutes while we go through questions in case anyone wants to access that link. There was a couple questions. First, what specific pharmacogenetic studies do you think should be done?
I think we have Dr. Swoboda on here. Much of the down the line, I am unaware of specifics. This is not my area of expertise in my training as a genetic counselor, and so I would defer. I believe she is on the line here.
Hi, yes, in spite of Tony's comments, I was able to get on about an hour ago and listen in a little bit. So I can comment that, one of the challenges we have with our AHC community is not so much the Flunarizine itself, but all the other medications they're on. And so I really think that we have to look at pharmacogenetic studies across this population to understand the interactions between different drugs. Flunarizine is well known to be widely metabolized variably, and that's been one of the biggest problems, and we don't have any data in babies specifically about how well this is metabolized. If we're going to really use this drug properly, it needs to have proper studies. I go back to one of the greatest mentors I've had over the years, Holmes Morton, and he told me 20 years ago, Kathy, please don't ever make the mistake that I made with leukodystrophy in recommending and continuing to use a medication that ultimately proved completely unhelpful, but had many negative consequences. And I take that very seriously. I think that Flunarizine, we don't really know what it's doing in this population. And yet there's a lot of hype and hope about this because it is one of the few medications out there that has led to significant benefit in a subset of individuals. I think until we do a proper study, we're never going to get an answer here, and it's going to continue to confound and interfere with other treatments that come forward, including new clinical trials with other agents, unless we can get the situation under control. That's so I open label studies, in my mind, I have done them many, many times for rare disorders. They almost always result in more confounding information than they do helpful information, in my opinion. And that's the main thing behind my interest in this survey, is that we as a community have tried to get this medication approved for a long time, or to do a proper clinical study for a long time, not approved. And yet we still have so little information about the drug and how it's impacting, all sorts of symptoms. For instance, one question that comes to my mind frequently is the many of the patients, older patients who ramp up their Flunarizine over time, is their Parkinsonian gait, their shuffling gait, in part due to the Flunarizine, long-term exposure to Flunarizine? And how would we ever be able to distinguish that from the intrinsic disease activity of the gene mutation? So these are some of the struggles that rare disease communities have across the board. And it's also me going back to basics. Abbie's a genetic counseling student. We want to engage new young people in this field. We still have failed to get more than a fraction of the community to answer this questionnaire, which literally takes 15 minutes, and just simply ask a number of short, basic questions. So if there's anything I can do to encourage people to spend 15 minutes and do the questionnaire, it could be helpful in us advocating for the community. And we're happy to share this information with anyone. But I think that I think for a family to be frightened that they can't get their medication because COVID has disrupted the supply lines and then ends up in status epilepticus or not, what are we going to do with that situation if we can't fix this? And this really doesn't apply to other countries who have a much different supply chain than we in the U.S. do for rare disorders. So that was just some of the things that I had wanted to add to Abbie's presentation, and I appreciate the time. Thank you.
Thank you, Dr. Swoboda. We had one other question from Tony, which was, how many families do you have so far, and how many did you need by December in order to have an effective study here?
Well, currently we have 15 completed responses from members, at least in the United States. Hopefully we're trying to get upward 50 and upwards of there to get enough individuals completed and hopefully get a bigger picture.
And you had how many so far?
15.
Yeah, and by the way, that's an embarrassment. 15. I mean, we as a community, for a 15-minute questionnaire just to find out if anyone out there is currently on Flunarizine or has been previously exposed or something. I do want to emphasize that sometimes the littlest things, like simply, will a patient even be willing to answer a 15-minute questionnaire, is a measure that we can use with pharma. Not even what the answer was, but if you could say, I honestly, naively, since I personally know 200 patients in the U.S. who could have answered this questionnaire, I honestly believed that Abbie would get no less than 100. If we reached out through the organizations, and sadly that's not true. And I will say that the organizations that are able to get treatments approved, they really need to emphasize the small stuff. Every single little bit of information and partnership that the community can do matters. It really matters. So thank you for your time.
And sorry, just to clarify from what you just said, Dr. Swoboda, you're looking for people who are specifically currently on Flunarizine or who have tried it at any point?
We're looking for anybody who's on it, not on it, tried it, not tried it. Anybody, any HC champion of any age. We simply want to know, and we can't even get an answer to a simple question like how many people are having disruption in supply lines, with this kind of simple questionnaire. So I think Abbie did a fantastic job in designing this questionnaire. It's very simple, it's very short, and we really need the U.S. patients to speak up and find out who is on it. Because again, I've been through this whole Flunarizine approval thing. This is the third time. I went, I watched Kenneth Silver and others do the initial Flunarizine study, And by the way, there were very few patients who were ultimately able to do the log, but it really did demonstrate that with those patients who participated, you know, they got some benefit. The majority of them got some benefit with duration, reduction in duration of frequency of episodes. However, the people who were inclined to do the log were the ones who were more positive about it to start with. So this is, again, the kind of confounding information that you get when you're talking about a rare disease. You have to have an unbiased population, and we can't assume that all of the patients with different mutations in this really complex gene are going to respond in the same way. And, you know, we just have to be able to know what the willingness of people out there, if we have a pharmaceutical company interested in doing a trial. The second part that I was involved with when Marathon was interested in doing the Flunarizine.
So the main thing we need to do is just go to that website and enter the code.
In the U.S.
That's what the parents need to do, right?
I worked with them closely.
All right.
I went to the FDA with them, and when we presented the data to the FDA, they had two drugs they were considering. Would Flunarizine be worth taking forward, or would this new steroid for Duchenne muscular dystrophy work? And the Duchenne muscular dystrophy community embraced it and really, immediately pushed at multiple different levels to say, yes, we need this drug. We know it's not very important. We know there's other kinds of steroids, but we think this steroid is better. It's going to lead to an incremental improvement, but we're going to put our money and voices behind it. We don't have that kind of unity in the HC population right now. We just don't. And it's because our parents are so overwhelmed and we have too few experts involved. We need to kind of get that together in a major way. And it's got to come down to the foundations partnering together, Cure HC and, the families. And I think that anything that we can do to move past this impasse, it's been a major barrier to moving forward for 2 decades for our U.S. patient population. I'm just going to say that very bluntly. And I can say that bluntly now that I almost died myself with a life-threatening medical problem. Without any fear, I've always been blunt, but we got to get it together. So that's the main reason I agreed to come today, present this data, so that we can try to get some basic 15-minute questionnaire filled out, if possible. That's it. Thank you all.
Kathy?
Yep.
Kathy, it's Siggy. Has this been distributed, this survey?
Well, the reason we targeted we targeted only U.S. patients because the U.S. FDA that is
okay.
But we've posted it many different places, and I think that we have to be able to get. I know the community is savvy enough to be able to go to a website and just fill out a survey. If we can't manage that, if we have to distribute paper forms like we have for 20, 30 years, the game is lost. We have to be able to show that patient families can be directed by their communities to go to a website, to enter a code, and to fill out a questionnaire. It can be done on their phone, it can be done on an iPad, it can be done on a computer, but that's the minimal level of engagement that we're going to have to be able to show. That for FDA to help in any way, that's what you're going to need to be able to do.
Thank you so much, Dr. Swoboda.
All right, thanks.
There was one question that came in. I think Abbie answered it, and one more question. That is there still a concern about switching from brand to generic or vice versa?
So I can answer that. I have no idea. I have no idea after more than 20 years of experience whether it makes any difference whatsoever, because there are so many different formulations. There are some made in Canada. There are some made in Mexico. There are some made in India. There are some made in Italy. And we don't have direct comparison for any of the ingredients for any of those. So Flunarizine is the generic name, right? So I think, again, that would require a study. All we're trying to find out with this survey is who's on it or not on it or tried it or hasn't tried it, or who will be able to respond to a questionnaire when we reach out to the community with a very simple, very basic need. That's really the point of this exercise. And it's perfect for a master's project for counseling because counselors require communication. I mean, we have to be able to communicate with the families to get information, and they have to be able to communicate via the internet these days, especially.
Great, thank you, Kathy and Abbie, for your time. I have posted the link that's on the screen in the chat, along with the code. So if you have not already, please consider filling that out for study. And Tony, I think I'll go ahead and turn it over to you for the closing comments.